Hello friends, welcome to my new video about the reasoning questions on the blood. So first question is that a clean or straight cut with a blade or knife that bleeds longer than an irregular injury. Why? So, in an irregular cut, bleeding time is less because the collagen gets exposed and a rough surface is available for the platelet aggregation and factor 12 can get activated. So that a clean or straight cut with a blade or knife that bleeds longer than an irregular injury with any stone. Then normal value of the clotting time by Lee and White method is about 8 to 12 minutes for a glass tube and 20 to 60 minutes for siliconized tube. So clotting time is more because siliconized tube are smooth surfaced and therefore activation of the factor 12 becomes slow or difficult, so that the value of the clotting time by the Lee and White method, that is about 8 to 12 minutes for glass tube and 20 to 60 minutes for a siliconized tube. Alpha and beta agglutinin are produced in persons who do not have the respective agglutinogen in their RBC. So antigens very similar to A and B antigens are commonly present in the intestinal bacteria and foods. Now when the newborn is exposed to these antigens, these are absorbed into the blood and the gut of the infant is relatively permeable to large protein molecules compared with the adults, so that the bacterial antigen get absorbed intact from the gut and induce a antibody production. Now, ORH negative blood should be used in case of extreme emergency like war casualty, train accident, etc. And ORH positive blood should be given in case if ORH negative blood is not available. So, person of the group O contain no agglutinogen or antigen, and so agglutination does not occur with any other group of the blood. So, O blood group can be given to any other blood group person, and the persons with this blood group are known as universal donor. So, the ORH negative blood should be used in case of extreme emergency like war casualties, train accident, etc. And ORH positive blood should be given if in case ORH negative blood is not available. Tissue ischemia occurs due to mismatched blood transfusion. Now in mismatched blood transfusion, there is a agglutination of the red blood cells occurs. Now this agglutinated red blood cells that block the certain vessels, and so that there is a tissue ischemia occurs. Ischemia means there is a decreased blood supply to that tissue or organ, so that the patient complains of the violent pain in the back or elsewhere and tightness of the chest. So tissue ischemia occurs due to mismatched blood transfusion. In mismatched blood transfusion, there is a hemoglobinemia. So hemolysis of the agglutinated red blood cells occurs rapidly and releasing large amounts of the hemoglobin in the circulation, and that is known as hemoglobinemia. Hemolytic jaundice may occur in mismatched blood transfusion. So hemolytic jaundice may occur due to excessive formation of the bilirubin from the hemoglobin that is released by the hemolyzed RBC. So bilirubin content increases and that leads to hemolytic jaundice. In mismatched blood transfusion, there is a circulatory shock. So circulatory shock occurs due to loss of circulating red blood cells and release of the toxic substances, leading to fall in the arterial blood pressure and decreased renal blood flow. So there is a circulatory shock in mismatched blood transfusion. Mismatched blood transfusion leads to hemoglobinuria. So hemoglobinuria occurs when total free hemoglobin becomes more than that can bind with haptoglobin, means plasma protein binding hemoglobin. Now this extra free hemoglobin that leaks through glomerular membrane and is passed in the urine and producing hemoglobinuria. Mismatched blood transfusion leads to renal tubular damage. Now, if the urine is acidic and glomerular filtration is slow, the free hemoglobin passing through the glomeruli that is precipitated into tubules as a acid hematine, and that acid hematine that obstructs the lumen of the tubules and that produces renal tubular damage. So in mismatched blood transfusion there is a renal tubular damage. The deficiency of the thyroxine, cortisol and growth hormone is generally associated with anemia. Now these hormones stimulate the erythropoiesis, possibly by increasing the oxygen consumption of the tissue and thereby promoting the tissue hypoxia. And tissue hypoxia in turn stimulates the erythropoietin production. Albumin, the first plasma protein to appear in the urine in the renal disease. Now albumin that has a molecular weight of about 69,000 and that corresponds to molecular size only slightly larger than that of molecules that get filtered through renal glomeruli. Hence, in renal disease, as soon as the permeability of the glomerular capillary is slightly increased, albumin gets filtered and appears into the urine. So, albumin is the first plasma protein to appear in the urine in renal disease. In the blood, the ratio of the white blood cell to red blood cell is about 1 is to 1000, but in the bone marrow, white cell precursor outnumber the red cell precursor, the myeloid and erythroid ratio being 4 is to 1. So what is the reason for this apparent discrepancy? So the ratio in the marrow is different because the lifespan of the white blood cell is much shorter than that of the red blood cell. That's why the production of the white blood cells has to be on a much larger scale than that of the red blood cells. Now administration of the anti-D that helps mother with RH incompatibility. So the problem of the RH incompatibility that arises primarily from the introduction of the fetal RH positive erythrocytes into the mother who reacts by synthesizing anti-D. If the exogenous anti-D that is injected at the time of the birth of the first child, it inhibits the endogenous anti-D synthesis by negative feedback mechanism and thereby suppresses the development of the potentially hazardous immune response. Now secondly, the infected anti-D might destroy the some Rh positive fetal red blood cells in the maternal circulation and thereby reducing the antigen availability. So the stimulus for the production of the anti-D by the mother is reduced. So administration of the anti-D that helps the mother with Rh incompatibility. Now vaccines are given after 3 months of the age, generally more effective than those given before. Now during the pregnancy, maternal immunoglobulin of the immunoglobulin G variety are transferred across the placenta to the fetal circulation, and these antibody protect the infant during the first few months after the birth, and the infant has significant level of the maternal antibody till about the 3 months of the age. Now during this period, exogenous vaccines are less effective because maternal antibody that exert a negative feedback inhibition on the antibody synthesis in the newborn. Secondly, the newborn's immune system is quite immature during the first 3 months of the life. Both these factors reduce the efficacy of the vaccines given before the age of the 3 months, so that the vaccines are given after the 3 months of the age generally more effective than those given before. The human immunodeficiency virus that paralyze the immune system. So HIV, human immunodeficiency virus, that is the virus that causes AIDS, acquired immunodeficiency syndrome, and HIV that paralyze the immune system by causing progressive loss of T helper cell. HIV, that is a extremely vicious virus with an amazing degree of plasticity. It undergoes changes in its genetic makeup throughout the course of the infection. As a result of these genetic changes, the virus may become more lethal towards the T helper cells or may become more capable of evading the immune mechanism of the body. And the fact that the HIV mutates within the host has made it all the more difficult to develop the AIDS vaccine. So in this way, the human immunodeficiency virus paralyzes the immune system. In case of the Rh incompatibility, why does the antibody given during the pregnancy not damage the fetal red blood cells the way naturally induced antibody may? So this is possibly because of the small quantity and limited life of the antibody injected. It neutralizes the fetal Rh positive cells which have leaked into the maternal circulation, and its titer keeps falling. On the other hand, the antibody induced into the mother can be produced continually and in ever increasing titer. So in this way, in case of the Rh incompatibility, anti-D given during the pregnancy that does not damage the fetal red blood cells the way naturally induced antibody. Faulty venipuncture that gives a bigger hematoma in elderly patients than in a young patients. So this is because in the elderly, the elasticity of the skin is poor, and elasticity of the skin also contributes to the initial phase of the hemostasis by building up the pressure around the injured blood vessels, so that there is a bigger hematoma in elderly patients than in a young patient. Thank you very much.